Namaste everyone and a very warm welcome to today's introductory session. So at Amogatrayi Wellness and Coaching Institute, every program is designed with one vision, that is to transform doctors into holistic healers by uniting the wisdom of Ayurveda with the precision of modern clinical science. Actually, about Amogatrayi, it's founded in 2024. Amogatrayi Wellness and Coaching Institute is an ISO 21000 2018 certified international platform. Actually, it's led by doctors, and we specialize in certificate programs on diverse topics such as clinical nutrition, PCOS, Ayurvedic dermatology, cosmetology, ortho-diagnostics like X-ray, MRI, USG, ECG. Actually, certificate programs on all topics. And also, along with this, we also run public health awareness classes, daily learning modules, online consultation services, etc. And let me also emphasize this, in today's world, skill development is absolutely essential, isn't it? To stand out as a professional. So, degrees alone are not enough. What really makes a difference is upgrading our skills, updating our knowledge, and applying them with confidence. So, that is the exact mission of Amoga Trail. So, within a short span, we have trained 1,000 plus doctors, nutritionists, students, and the feedback is overwhelming. Uh, that is, a doctor shares that our program are clear, clinically practical, and confidence building. And so, let me introduce about myself. I'm Dr. Atira Mohan K, founder of Amoga 3, and by profession, I'm an Ayurvedic doctor. And over that, I have pursued multiple additional certifications in clinical nutrition, cosmetology, women's health, infertility, counseling, yoga, meditation, lifestyle medicine, etc. And my mission is to make Ayurveda scientific, global, and easy to apply in daily practice. So through Amoga 3, I have had the privilege of guiding hundreds of doctors, students, and wellness professionals to integrate Ayurvedic root cause healing with functional medicine and evidence-based nutrition also. So now, coming to today's session, we are deeply honored to be joined by two exceptional experts. Ms. Binu Bhatia ma'am, she's MSc Food and Nutrition, NET, Senior Consultant Clinical Nutritionist with decades of expertise. She has trained thousands in clinical and functional nutrition. And Dr. Anjana Madhu ma'am, BMS, FMC, Low Carb Nutritionist, Diploma in Skin Care Formulation. She's a pioneer in Ayurvedic cosmetology and skin health, bridging classical Ayurvedic wisdom with modern dermatology and clinical practice. So, today's class is an introductory session where our expert faculties will guide you, share their wisdom, and give you a glimpse of what's coming up in the VARNA Jeevan Intensive Certificate Program on Hyperpigmentation. So, without further delay, let us begin. I warmly invite Ms. Binu Bhatia ma'am to start today's session. Please, ma'am.
Good evening, everyone, and thank you, Dr. Athira, for such a nice introduction. So, coming to the session talking right now, like nutrition is a very important part in each and every field. It's not like for the skin or for anything, it's important for everything, and it is the only part which is often overlooked also. For many of the disease or for many of the problems in the life, it is overlooked also. So both the things are there. So let us start with the so basically, as I was telling you about, that nutrition is an often overlooked factor also, which basically significantly influences skin health. See, our whole body is made up of whatever we are eating. I hope the screen is shared. Everybody is able to see the presentation?
Yes.
Okay. So now when we are talking about the nutrition, like why nutrition is important, see, your body is made up of whatever you are eating. So your body is made up of amino acids, your body is made up of carbs, your body is made up of fats. Okay. So even in for the hyperpigmentation also, your nutrition plays a very very important role. And yes, till now nutrition was overlooked. It was also important also, and people used to rely only on the medicinal things. But now they have understood, yes, nutrition is important part when it comes to the pigmentation or when it comes to the skin problems also. So coming to the topic, like when this course will be starting, we will be covering all these things, like what is exactly hyperpigmentation, what are the biomedical nutrition links for that, like why pigmentation occurs in the body, and so why pigmentation occurs and what are the key nutrients in the pigmentation, and then your food protocols, how the food protocols work, and what is the gut health and microbiome relationship. Now very importantly, if I'm talking about gut health, people think that gut health is nothing to do with anything, and in reality gut health is associated with each and every part of your body. Okay, so see, in our body what is happening, like we are having a brain is the major system we are having our central nervous system, so that is CNS. Our whole body is controlled by CNS, that is there. But our gut is not controlled by CNS. For the gut we are having another system, that is your enteric nervous system. That is why gut is also known as a second brain of our body. And yes, gut is very very important part when it comes for the treatment of many disorders also. Even if our gut health is good, our other health will physical other health is also good, our other organs are also good. Now there are many mechanisms which we will be studying during our course also, which by through which mechanism, like our gut health can be controlled, our gut health can be it can be in a good form. If there is a problem in a gut health, how we can treat that issue, and if our gut health is good, how it will be affecting our other physical health. Like for example, if we are talking about diabetes also, if we are talking about inflammation also, if your gut health is good, you can reduce inflammation. If your gut health is good, you can reduce your diabetes also, your blood sugar levels also. So it is related for many of the things. And similarly it is related with the pigmentation also. So we will be studying all these pointers when we will be doing this course. So coming to the like today we are here to give you the glimpse of the course, like what all things we will be doing. So when we talk about the nutrition does not only talk about that you have to just eat this or eat this. Why you have to eat that? What is the role played by eating those things? That is an important part. And you should know that what role that particular thing is playing in your body. So coming to this, so exactly, like what is hyperpigmentation? So we all know in a layman term, if we talk about that, the skin which has dark patches or which has your discoloring, uneven discoloring on the skin, so that represents hyperpigmentation. That is in a layman term. But if we are talking about like types of hyperpigmentation or what exactly it is, that is basically your skin condition where dark patches are due to the excess melanin. Okay, so melasma can be there, freckles or sun damage can be there, and post inflammatory hyperpigmentation can be there. So all these types of pigmentation, hyperpigmentation, and the causes for the hyperpigmentation we will be talking about. Now if in general when we talk about pigmentation to the people, somebody says no, it is genetic, some says it is sun exposure. Now there are many things. For example, it is not only due to the sun exposure. Yes, sun exposure is one of the factor which can cause hyperpigmentation, but sun exposure is not only the factor. Your hormonal changes, for the females if we are talking about, your hormonal changes are major cause for the hyperpigmentation. How? We will be talking about when we will be doing our course. And for example, females suffering from PCOS, they are more they are on a more risk for having the pigmentation. Then your inflammation. Again, when we are talking about the inflammation, now see, inflammation is reason for many of the problems in the body. It is the cause for your risk, diabetes. It is the cause for your heart disorders. It is the cause for your pigmentation also. And and it is also inflammation is also cause for your aging also. Then aging is also one of the cause for the pigmentation. Then your medications, nutrient imbalances. So all these are the causes for the hyperpigmentation, and we will be talking about the causes during the class also, like how they are, um, how these causes are basically the reason for the pigmentation, and what can be done to reduce these causes or to reduce the pigmentation. So as we were talking chemical reactions, all these are the causes for hyperpigmentation. So now, coming to the nutrition part. So when we are talking, see, there are obviously there are your pharmacological medicines are available, which are important for the reduction of the pigmentation also, and for improving your skin texture or whatever the things are. But again, we should not forget that let food be the medicine. Your food is in the kitchen, you have your medicine for each and every disorder, and the medicine be the food. So this is as true as it is, because food, your nutrition or your food is, they act as a medicine. So whenever we say, like, whatever we are allowing our body, whatever we are allowing within our body, that reflects our health, that reflects our skin, that reflects our everything. So obviously your food is the medicine, and your medicine can be the food. So it is very important. So we will be talking about the we will be talking about, like, what is hyperpigmentation. We will be talking about the major causes and how it is affecting basically the pigmentation. And we will be talking about all the nutrients. We will be talking about nutrients which help prevent and reduce hyperpigmentation, and what is the role played by that particular nutrient in the treatment, in the treatment of the hyperpigmentation. We will be talking about that. So first we are, like, suppose we are talking about vitamin C. Now vitamin C is an antioxidant. It inhibits your melanin also. So yes, it is an important part of your diet. It should be an important part of your diet. And all the citrus fruits, they have vitamin C in it. The your peppers have vitamin C in it. Other than that, your, like, guava is good source of vitamin C. Amla, gooseberry is good source of vitamin C. Then your berries are good source of vitamin C. So all these should be included in the diet. Then coming to vitamin E. Now vitamin E, along with selenium, it protects from UV damage. And your all the nuts, your seeds, they are good source of vitamin E. Spinach, avocado, even they are good source of selenium also. And your nowadays, we people are hearing a lot about Brazil nut also. So Brazil nut is again a good source of selenium. And if we are talking about the selenium, the recommended dietary allowance for selenium is very small. And selenium we need for a small amount only, but we do need it. We can't ignore that. If there is a deficiency of selenium, we will be suffering from the issues. Then coming to vitamin A, again vitamin A is also your good source of antioxidant. Plus it supports your skin renewal also, like all your orange and yellow fruits and vegetables, they are good source of vitamin A. Then your polyphenols and flavonoids, so all your like polyphenols and flavonoids are one of the phytochemicals. So phytochemicals are basically the chemicals which are good for the health, which are present in the plant. So those are known as phytochemicals. So for polyphenols and flavonoids, they are your phytochemicals, and they are present in many of the plant products such as your green tea, your berries, and it reduces the melanin also. So another important part is your healthy fat. So normally we always say that fat act as a villain, but it is not. It does not act as a villain if it is taken in a correct amount, and if the correct fat is included in our diet. That means healthy fats are included in our diet. So that is not a villain. That is your hero of the hero for your body. And trans fats and saturated fat are also good, but if they are taken in a moderation. If they are not taken in a moderation, if they are taken in a more amount, obviously they will affect your health. Plus your healthy fats includes omega-3 fatty acids. Now these are very important part, and omega-3 fatty acids, like, it reduces the inflammation. Now the major source of omega-3 fatty acids in normally we have three types of fatty acids, omega-3 fatty acids. We have three kinds of omega-3 fatty acids. One is your DHA, one is your EPA, and one is your ALA. Now EPA and DHA, these two are available in the fatty fishes such as your salmon, sardines, and mackerel. So they are in the fatty fish. And ALA is the plant form of omega 3, which is present in your flax seeds, chia seeds, mustard oil, and walnuts. So these are the only sources of for omega 3. Now, the important part over here is that EPA, DHA is used for the cognitive health, and EPA is used for the for reducing the inflammation. That is why omega-3 fatty acids is the healthy fat which should be consumed by the people to reduce the inflammation. Okay. Now, obviously, there are many food and factors which are responsible for the risk of pigmentation, or which are the cause for the pigmentation. Now under this, if we talk about, and they can worsen your pigmentation also. Now one is your high glycemic index foods. We will be talking about what is exactly glycemic index and what is exactly glycemic load also in the class. So high glycemic index foods, when we are talking about, so all your white bread, sugary drinks, or we can say high glycemic index foods are those which are eaten by a person and immediately they give you a blood sugar spike in the body. That means as soon as you are eating that particular food, your within 15 minutes your blood sugar will be on a rise. So that is your high glycemic index foods. So when we are talking about the glycemic index, so we have the categories: low glycemic index food, moderate glycemic index food, and high glycemic index food. So when we are talking about the high glycemic index food, they can trigger the inflammation, such as your simple sugars, your junk food, your burgers, your pizzas, your KFCs, your McDs, everything which is junk. So these are all high glycemic index foods. And low glycemic index foods are your seasonal vegetables, your dals, your all the vegetables, and some fruits are also low glycemic index. Otherwise, fruits are moderate glycemic index. And all your cereals, such as your millets, basically, they also come under the low glycemic index food, so they can be included in the diet. Then your all processed and red meats. That means these all processed and red meat should not be eaten. They again worsen the pigmentation. Why they worsen the pigmentation? Because again they are the reason for the oxidative stress. So we will be talking about the oxidative stress also. And when your oxidative stress is increased, it increases your inflammation also. Then excess alcohol, again it impairs your skin repair. Then low antioxidant, so all these. Now low antioxidant diet, again it is susceptible to sun damage. So all these things are basically bad for the health, and they will be affecting your health. Now exactly, anybody tell what is oxidative stress? Anybody from
Free
the
radicals,
group can tell what is oxidative stress?
production of free radicals,
Free radicals. Yeah, free radicals. Okay, then
reactive oxygen
other than
species,
that, yeah, reaction or oxidative species. Okay, so basically, when we are talking, I'm just share one slide also for oxidative stress. Just give me a minute. Yeah, I'm just sharing one slide over here. Okay, so are you able to see? So basically, when we are talking about the oxidative stress, yeah, Dr. Sonal, you are correct. Now, see what is happening over here is, see, oxidative stress is when there is an imbalance in the body where there are too many free radicals. Now, too many free radicals. Now, when we talk about the free radicals, so basically, free radicals are your single oxygen molecule, that is your free radical. Actually, the oxygen molecule, like whenever it is in a group of two, we always write O2. Okay, so that is the stable form of oxygen molecule. Whenever it is single, that becomes your free radical. Okay, and it is unstable, and it is unstable. So what that free radical is doing, that will attach to the normal cell of your body, and it will take nutrient and oxygen from the normal cell for its own growth and development, or for its own survival, and it will destroy your normal cells. So as you can see in the diagram also, so when cell is attacked by the free radical, it will take their nutrient and oxygen, and it will destroy the normal cell. So that normal cell becomes that normal cell becomes your is basically with the oxidative stress. So that destroys your normal cell. Okay, and oxidative stress also increases your inflammation also. So now these oxidative stress, basically, that has to be reduced, or free radicals has to be neutralized. So how they are neutralized? They are neutralized through antioxidants. Now this imbalance can lead to cellular and tissue damage also, and it can lead to many of the health problems. It can lead to cancer also, it can lead to the more aging process also. So as you can see, now the cause for the oxidative stress is, you can get oxidative stress through ROS, that is from your metabolism in the mitochondria electronic chain. Through the electron chain, you get the ROS, that is there, that is produced in your, synthesized in your body itself. That is one thing. Other than that, you get from the like your UV light, you get from the air pollution, you get from the radiations, you get from the smoking, you get from the junk food, and all these things can damage your cell also. And due to this oxidative stress, you can get the allergies, you can get the cancer, you can get diabetes, cardiovascular, inflammatory disease, neurodegenerative disease, and your skin problems also. So how to neutralize this? So antioxidant can neutralize this. So, and what antioxidant is doing? Antioxidant is donating one of the electron to the unstable, your free radical, and when that unpaired electron is paired with the the donated electron, it becomes stable, and your oxidative it does not at after getting the electron from the antioxidant, it becomes stable, and it is now it is not a free radical. So it will not affect your normal cells, and your oxidative stress will also be reduced. So this is exactly the oxidative stress. Okay. Okay, understood oxidative stress. Any query related to the oxidative stress? Okay. So the next part is like how the nutrition is going to help you in hyperpigmentation. So basically, when we are talking about the nutrition, so obviously nutrition and some lifestyle synergy, they both combine, and they can treat hyperpigmentation. So it's not only the pharmacological things can only treat. Yes, pharmacological things are also important, but along with that, your nutrition is a very, very important part when it comes for the treatment of hyperpigmentation. So when we are talking about this, your balanced diet is very, very important. It should be rich in antioxidants, it should be rich in anti-inflammatory foods also. So anti-inflammatory diet, if we say, or anti-inflammatory foods, they are very important part of the treatment for the hyperpigmentation. Other than then, sun protection is very important. So SPF, hats, shade, that they are important. Then your hydration is very important because it supports your skin repair. And other than that, you have to avoid the oxidative stress accelerator. One of it is your smoking. Then you have to avoid all these kind of things. Your smoking is there, then your alcohol is there, or your
I thought.
if we are talking about the junk food or eating and it is always said that don't eat the food from the packet. Homemade cooked foods are much better as comparative to the food which is packed in a packet. So don't open the packet and just uh, eat those kind of foods. Add those kind of foods into your body. They are full of chemicals, they are full of preservatives, which is going to worsen your pigmentation much more. Okay. So any query you want to ask? Somebody wants to say something? I am not able to hear. Okay, so we will be stopping over here because we will be adding the things in when we will be doing the course. So we will be doing everything in detail. So any query you want to ask, you can ask.
Ma'am, hydration only supports skin repair or it also gives glow to the skin?
See, basically, hydration has many other factors also, like many other things also. It's not like only skin repair. Skin repair, it supports skin repair. That is an important part. And see, when we say hydration, because all your skin, that they are made of the cells only, and when there is a balance in your cell, when there is a hydration, like there, if your cell is dehydrated, so it will be affecting your skin texture also. So you would have observed also na ki when you're in the like in winters also, when your cells are dry, like when there is a dehydration in the body, you can see the shrinkage of the cells. So those things also occur due to the dehydration. So hydration supports those things also, and it also that makes particularly your skin repair. Glowing part comes from the hydration plus the balanced diet you are eating, because if your cell is healthy, you will glow. but that is due to the balanced diet, nutritious diet if you are eating.
Okay, ma'am.
Okay. Okay, yeah, anybody else wants to ask something, you can ask if you are having any query.
Yes, ma'am. Ma'am, is sun exposure good
Yeah,
for the
tell me.
skin or ma'am, is sun exposure good for
Priyanka?
the skin or it is side effect?
See, sun exposure is good for the skin for vitamin D, because you get the, it is a good source for vitamin D for the body. So obviously it is good, but the time of that exposure is important. Like if we talk about, if you are going for the for vitamin D, if you are sitting in the sun, so that is basically like from 11 to 4, if we say, that is the, normally we say 11 to 2, in between that. And that also, that is for half an hour you sit and you get it. That is one part. But if your body is having a risk of pigmentation, or if you're suffering from some kind of skin disease, in that case sun protection is important. Another part is, because when you go for the vitamin D thing, you don't have to use SPF in that case. If you are using the SPF, obviously your body is not going to absorb the your body is not going to absorb the sun rays and not going to convert it to the vitamin D form. So in that case you have to remove the SPF. Other than that, if your body is having a risk for the pigmentation, or if you are going outside, it is important that you should use SPF or hats or shades, so that there can be the protection from the sun. Obviously, if your skin is like there is more exposure to the sun, it can be harmful. It depends on the individual skin also. Okay, Priyanka.
Yes, ma'am. Okay, ma'am. Thank you.
Yeah, anybody else?
Ma'am, what happens to the cells when there is a tanning on our skin?
When there is a,
Tanning from the sun.
I didn't get your question. What you are, when there is
Ma'am,
a
what
tanning?
happens? Yes, ma'am. Yes, ma'am.
So you want to know that what happens to cell when there is a tanning from the sun?
Yes, ma'am.
Okay. See, normally in our body also, if we are talking about these things, if we are talking about, see now, again, when we say that tanning is there, basically the sun tanning is the skin's protective response to the damaging UV radiation. Normally, it is that. And it triggers cells called melanocytes to produce more melanin, so that the pigment that darkens the skin. So we know that whenever there is a tanning, so tanning is due to the more production of the melanin. Okay. Now exactly, if we say that you asked me that what happens to the cell from tanning from the sun, due to the tanning from the sun. So basically, in that case, what is happening is, sun tanning is the skin's protective response. See, normally our body has the defense system. Okay, whenever something is entering in our body will be having a defense system for that particular thing. Any virus, any your foreign material mechanism for that. Similarly, for your sun radiations also, your body do have the defense mechanism. So basically, the sun tanning is the skin's protective response to damaging UV radiation from the sun. Now, what happens is, when your body is having more of the UV radiation, in that case, it triggers cells called melanocytes basically to produce more melanin. And when more melanin is produced, that pigment, that actually the melanin, that pigment, that darkens the skin. So that's why the sun tanning happens. This process causes the skin to darken and providing a defense against further UV damage. So it will not damage your skin further. One thing is this, and this is still a sign of the skin cell damage, which can lead to premature aging also, uneven skin tone, or increased risk of developing skin cancer over the time. Now it depends like how much time it has been there. So otherwise, if we say tanning is the basically tanning is the body's way of trying to protect itself from the harmful effect of UV radiations. But if we say that at the cellular damage, if we talk about even the tan without a burn, that is the sign of DNA damage to the skin cells. If there is a tanning in the skin, but it is not due to the sun, then it is supposed to be the sign of DNA damage to the skin cells. So it depends. And if there is an excessive exposure to the UV rays, or it is the prolonged exposure, then it can reduce the skin elasticity and premature skin aging can occur. So basically, if there is a regular tanning in the skin, then it can lead to it will destroy the elasticity of the cells basically, and it will lead to the premature aging. Okay,
So, ma'am, how
and
can we
sometimes if
prevent it
these,
from happening?
how can you
How can we prevent it from happening?
see, that only I am telling the prolonged exposure should not be there. And if there is an exposure also, like if you are into the field job or something like that, then sun protection has to be there. So either you can use SPF, or you can use shades, or you can use hats also. So that in that way only, and plus balanced diet, that is more important.
Okay, ma'am.
Okay.
Ma'am, what sort of
Okay.
anti-inflammatory foods is required?
See, because inflammation, whenever there is a hyperpigmentation, that is one of the cause for that hyperpigmentation is your inflammation also in the body. So whenever your inflammation is on a high rise, basically it will lead to your inflammation can lead to many other issues also. Might be in some people it can lead to hyperpigmentation. So over there, your anti-inflammatory foods are important, and anti-inflammatory diet will help you to reduce the inflammation. So when your inflammation is reduced, obviously, it will also reduce your hyperpigmentation. Okay. And for the anti-inflammation diet or anti-inflammatory diet, we will be talking about the whole diet in the course itself.
Okay, ma'am. Thanks.
Okay, Dr. Mugdha.
Okay,
Yeah.
ma'am. Thanks, ma'am.
Ma'am, is there any
Yeah.
major effect
Anybody
of
else is having?
yes, ma'am. Is there any major effect of blue light on the skin, and how long that exposure can damage the skin?
Yes.
Like duration of exposure of sunlight and the blue light that causes damage. Can you please explain, ma'am?
See, when we talk about the sunlight, obviously, sun tanning is the first skin's protective response. And but if that sun exposure is much, then obviously it can lead to many of the other issues also. But when we talk about the blue light, now see, blue light nowadays, the blue light exposure is like anything. You can say about mobiles are, or 24 hours mobiles are with us, then laptops, computer, your LEDs, everything. So yes, blue light, exactly, if we talk about, it does not cause tanning, but it induces melanin overproduction. Induces melanin overproduction. It leads to hyperpigmentation, it leads to dark spots, it leads to uneven skin tone, and it also, and majorly especially in individuals with darker skin tones. Now how it occurs, basically your blue light, that also basically triggers your skin's melanocytes, your pigment cells, to produce excess melanin, and that pigment is responsible for your skin color. Okay. So in addition to pigmentation, blue light exposure can also cause oxidative stress also. Yes, blue light is also the cause for the oxidative stress. So further this oxidative stress can increase the inflammation, which further again leads to hyperpigmentation also. That is one thing. And your blue light also damages the skin barrier also. It breaks down the collagen also, leading to the premature aging also. And it do contributes to the premature aging, as I was saying, such as your wrinkles and fine lines. So yes, blue light has the effects on skin pigmentation. So it activates the melanocytes basically, and there is an excess melanin production, and visible pigmentation is like seen when there's a lot of use of blue light. That is there. Now as such, if we are talking about, because see, blue light normally we are getting from all your smartphones, computers, tablets, and even nowadays we are using LED lights in our home also. So LED light is again the source of blue light. All our home now, these lights are LEDs. So these are the source for the blue light. So all these fluorescent light bulbs or all these tube lights, they are the source for the blue light. So yes, blue light is affecting. As per the time, if we say that like how much time if blue light is we are using, and how much time it will take to affect our skin. So as such, the long term and consistent blue light exposure can lead to damage your skin. That is there. Other than that, we can't say as such time, because every skin has their own, like every body individual is different. So but yes, blue light can harm skin in the form of, like, it can accelerate your aging, because blue light penetrates deep into your skin. Again, it creates your free radicals, which can further damage your collagen or elastin, leading to the problems in your skin elasticity and firmness. So further leading to your premature aging, such as your wrinkles, fine lines, or sagging skin. So that is there. And then hyperpigmentation also, due to the increased melanin production. So it can be, it is harmful. And one more important thing for the blue light is, that is your disrupted repair cycle. Now, I think in over here also, if we are in this room also, if we are talking about, I think 80% people, late night exposure, that interferes with the skin's natural repair and regeneration process that occurs during the sleep, leading to dullness and dryness. And this is one of the major cause which is leading to more of the skin problems and more of the hyperpigmentation also. So I think 80% of people who are present over here also, because when we go to the bed, we are still scrolling, or we are still seeing our smartphones. So the exposure of blue light is such that it affects our health. Okay, Dr. Tejaswini.
Yes, ma'am. Thank you. Yes, ma'am. Thank you.
Ma'am, can sun exposure also lead to skin reaction and itchiness on the skin?
Yes, it can lead to. Depends. See, these things are depending individual to individual also, because definitely it depends on your melanin production also. It depends on your um, defense mechanism also. Okay.
Okay, ma'am.
Okay. Okay. So any other query? Okay. Yeah, Dr. Athira, are you there?
Yes, ma'am. Yes.
Yeah, Dr. Athira, over to you.
Thank you so much, ma'am, Thank you so much, Ms. Birung Bhatia, ma'am, for this valuable insight. So now it's time. I would like to invite our esteemed expert, Dr. Anjana Madhu, ma'am, to start today's session. Please.
Thank you, everyone.
Hi, doctor. Can you hear me?
Yes, ma'am, yes.
Okay. So, good evening, everyone. Like myself, Dr. Anjana, practicing in Kerala as a cosmetologist. My main stream is cosmetology. Basically, I am an aesthetic physician, so dealing with both aesthetics combination. I'm doing a combination therapy of aesthetics and Ayurveda together. I'm not sharing any PPT. I would like to do this as more of kind of an interactive session, like many of you are dealing with this hyperpigmentation in a daily basis. So I would like to take it as an interactive session. I will briefly tell the points which all you have to notice, and more detail will be in the upcoming classes. Okay, so you will get a brief idea about how to deal with how Ayurveda can manage this hyperpigmentation very easily, like that. So before going to start, how many of you are, you can put in chat, or how many of you are dealing with the hyperpigmentation in your clinic? Daily. Okay. So like you all know, as we are practicing the cosmetology, most people, like I think like 50% of the cases, we have to deal with this melasma condition. Am I audible?
Yes, ma'am.
Okay. So melasma or hyperpigmentation, whatever it be, most of the people, most especially women, because it's a condition now, it's affecting the self-esteem or self-confidence of most of the women. So they will approach you after trying so many creams and all, after trying so many dermatic products, they will approach you. Okay, let me try what Ayurveda can do, right? I am daily dealing with like 10 or 15 people with this hyperpigmentation and melasma. So when we are considering the hyperpigmentation, which is the most common thing you are dealing with? Is that melasma or PIH? What? Like, what are the cases you are dealing with in your clinic mostly? Mostly we can deal, most of the people will approach with the melasma. PIH. Yeah, PIH will also be there because that is the post-inflammatory hyperpigmentation. Okay. So anyone, any of you can answer me. What do you mean by this hyperpigmentation? What is happening there? That all I think you heard in the first class, but anyway, like that's the basic thing. What is happening to the skin? Melanin overproduction. Yes, it's because of the melanin overproduction. And what is the age group which it starts mostly? Only one is answering. You all are dealing with the cases or you are new to this. But yeah, basically from 30 mostly. Okay, from 30s, it starts like minor spots. So basically it is a patches of skin that become darker than the surrounding skin. That is basically the hyperpigmentation, and that is due to the overproduction of melanin. So which areas mainly the hyperpigmentation seen? That is the face, neck, sometimes the chest also be visible, but we are dealing with the face and neck. Could you please just tell me the neck, what is the darkening of skin on the neck region called? That is also a kind of hyperpigmentation, and that is most commonly a case which we are dealing in Ayurveda. Yes, Dr. Nasira, I saw you in the chat. Yeah, acanthosis nigricans that we can easily manage in Ayurveda with Ayurveda and aesthetics. Like I am managing it with Ayurveda and combination therapy like peels. Peels also I will incorporate with our Ayurveda. So that is a one kind. Okay, so what are the types of hyperpigmentation? Mainly the first one is that is the age spots or liver spots, that's called. That is the brown, tan or black spots. That you can recognize very easily. That is the sun spots, exactly. Due to the sun exposure, we can see that age spots. It is either as black or tan. Some people will approach you at this condition. That is very easily to manage. And the second type is the melasma. That is the larger patches. Large patches of darkened skin. That is the melasma. And the PIH, that is the post-inflammatory hyperpigmentation. It's basically mostly happen because of acne or some kind of any kind of inflammation or any burns, or that comes under the PIH, the post-inflammatory hyperpigmentation. The next one is freckles. What do you mean by this freckles? And who is the common people, like who can affect this at what stage, or is that in adult or in childhood? Freckles basically we can see in childhood due to the sun exposure. So kids, you can easily diagnose this freckles. Small spots will be there. The progression of freckles leads to the other conditions. And yeah, mostly in the fairer skin that we can easily recognize the freckles. And another one is, have you heard about the maturational hyperpigmentation? Another type of hyperpigmentation, that is the maturational hyperpigmentation. It basically we can see in the sides of both the face, sides, that is here. That is the maturational hyperpigmentation. Why? Because it is called as maturational. It is the gradual darkening is happening there due to the sun exposed skin. Overexposure of skin, the skin become the maturational hyperpigmentation. It will be seen on both sides of the face. That is the maturational hyperpigmentation. Then another type of hyperpigmentation that we can see around that is the periorbital hyperpigmentation. That also we can consider and we can treat under the hyperpigmentation cases. That is the periorbital hyperpigmentation. And the last one is acanthosis nigricans. That is around the neck region. In this, the melasma and the PIH. Each variety we can treat very easily in the first stages. As it advances, treatment also needs more time. So when people approach your clinic, or what Ayurveda we people can do is, we can give an awareness to the people about this hyperpigmentation. At what age you will start? What are the preventive measures you have to do for this hyperpigmentation? What are the care you have to, what all skin care? So we can prevent this. Okay. What it is called like, yeah, prevention. That is, once it starts, it will progress. So better tell them to take care of their skin by using a proper sunscreen, SPF 50 above. And what is the most important factor? As you are practicing an Ayurvedic cosmetologist, what is the most important thing you have to do first when a person approach your clinic? What is the first thing you have to do? There are some like protocols, or what is the first thing you have to do? Identify the cause. Yeah, proper history. Then that's it. Yeah, sunscreen, yes. The basic thing is you have to understand the cause, but first you have to check what is their skincare routine. Are they switching the products? Are they using a proper skincare? Whether they have a proper AM and PM routine. What is their diet? Why diet impacts hyperpigmentation? Yeah, food habit, but what is the main thing? I don't know how many of you have asked these questions to the people who are coming to yeah, inflammation. But if you consider about the dosha prakriti, which will be more here for hyperpigmentation, and what is the most thing we have to ask? There will be a pitta aggravation there. So if you check with the diet, you can ask them, are you a person who is having more spicy or pickle eaters? So most of the people will say yes, because they will love, because their pitta is aggravated. So tell them to stop that. Tell them to stop the spicy foods. Tell them to avoid the pitta aggravated food. So these are the, that's, we went to another thing, but these are the basic types of hyperpigmentation. In this, we mostly seen or that most treated cases will be melasma, and some will be PIH. Okay. And coming to melasma conditions. Okay. So what are the basic creams, or how many of you are aware about the different kinds of topical creams or things? Can you tell the names? Because you have to ask the client about what all creams or what all topical applications you have applied earlier. Have you heard about that? Names of that? That's also a third protocol. Yeah, retinols, niacinamide. Then AHA, BHA. Yeah, steroids. Yes, that is the main thing, steroids. Most of the people coming to or approach to you after using so many steroids, or they are using it while they approaches you. So you have to tell them, taper it and stop it, then progress your treatment. Basically, hydroquinone, topical retinoids, topical steroids, acetic acid, kojic acid, these are the basic content they given as the creams. While coming to melasma, melasma can be of 3 types, depends on the depth of melasma. That is the first one, basically 3 types. That is the first one is epidermal, the second one is dermal, and the third one is mixed. In the 3 types, the epidermal is very easy to manage with our labas and internal and external applications. If that is the dermal one, then we have to we have to do the microderma abrasion or micro needling and all. But most of the cases, like if it's not that dark and if they are approaching in the first case itself, then that will be the epidermal. You can diagnose it easily with what is the diagnostic method? What is that instrument called? Woods lamp? Yes, you can easily diagnose it with dermascope. Both dermascope also, you can at least you will get a brief idea about whether it is epidermal or dermal. If it is epidermal, then it easy, we can manage it with internal and external. Okay, so that is the melasma. And PIH will be basically because of the acne scars, and that also we can consider in this hyperpigmentation and we can treat accordingly. Depends on how the thickening of the skin, how the scars will be, depth of the scars, that also we have to consider. These all are the modern aspect. My approach, or I have to give you the detail about how we can deal with this with the Ayurveda. So, in Ayurveda, melasma can be compared to what? Or this hyperpigmentation. Acharya mentioned, yes, it is Vyenga. We can consider or we can correlate the melasma or hyperpigmentation to Vyenga, and that is a Shudra Roga or Rekta Pradoshaja Vigara. And the Lakshana itself is Niruja and Shava Varna Mandala. So that is similar, right? It is Niruja and it will be Shava Varna Mandala. So mainly we have to focus on Vada, Pitta and Rekta. Can you, any of you can tell me, like, can you just tell me which Pitta we have to focus here in the case of melasma or hyperpigmentation? Rajaka Pitta. So we have to always keep this in mind and our treatment should be focused on that. The Prajaka Pitta, that we have to focus. So how the treatment side will be? What is the, how we will treat is, we have to focus on Pitta, Rekta and Vada. How the treatment will be, mainly we have to do the Shodhana and Shamana Chikitsa. Yeah, Pitta Virejana. Yeah, Virejana is one of the exact treatment we are doing for the hyperpigmentation cases. Basically, Nidana Parivarjana. First, we have to do the Nidana Parivarjana, then Shodhana. And what will be our main aim if we are choosing the labas in the case of melasma or hyperpigmentation? Yes, we have to choose the Rakta Prasadana, Twak Prasadana and Varnyakara. That will be our aim. You can mix and match all the textual or the what all yogas acharyas mentioned in this. You can mix and match according to your yukti. Main thing is here, while we are treating your cosmetic cases, you have to use the yukti. If I am treating a case, if that patient approaches to you, then your treatment approach will be different. So that is the main thing we have to focus. And what is the main thing we have to do if a patient approaches to our clinic for the first time? What are the main things we have to keep? Like, we have to know whether it is reducing or not, right? How we will do that? Every time the patient approaches the clinic, approaches to you, you have to take the pictures. That is the main thing. Then only we can tell the patient that right now your condition is reducing. We have to document it. So, basic thing we have to do first is you need a proper case history and you have to check for the proper skincare. Like, you need, if you are practicing cosmetology, you need a foam, like a skin analyzing foam or a skin foam. In that, you have to tell the patient to fill the details. In that, you have to check for the products which they are using. They have to mention what all treatments they did prior before they approaches you. Then only you will get a brief idea about how they manage the hyperpigmentation till they approaches you. So that is very important. And a consent. You need to sign, or they have to sign a consent that, okay, I understand, doctor explained everything. I need to undergo these and these kind of procedures because what we are dealing with is the Rakta Prasadaga, or mainly the Manjishta, Rakta Chandana. So many drugs we are dealing with in the case of the hyperpigmentation. So we can't predict whether, like, there will be allergies happening. So we have to take a consent that, okay, I understood that there will be some kind of allergic reactions, but that is manageable. That consent is necessary. So that all consent forms and all I will share in the coming classes. And the main part is you have to analyze the prakriti of the patient. Before treating the pigmentation, you have to analyze the prakriti. You have to correct their diet. You have to correct the skincare routine. Then start with internal medications and external labors. So this is the basic idea how Ayurveda approaches the melasma or hyperpigmentation. And we can combine together the aesthetic treatments and Ayurveda together, like chemical peeling, then micro needling. These all we can combine together in the journey of or in the process of treatments we are doing to the patient. We can combine it together. Then you will get a better result. And medicines, you have to choose the right medicines for the internal medications. The aim should be to reduce the pitta. We can do different types of facials, so many things, so many combination cosmetic treatments we can do for this hyperpigmentation patient. And the happy part is that once the hyperpigmentation subsided, or once the patient feels that it is subsiding, they will stick on to you. They won't go. Whatever be the reason, or whatever things they are happening, or whatever they are facing, whether it is a skin condition or hair condition, they will approach you only because they will be much happy. Why? Because while doing the treatment, they can feel the difference that their marks is subsiding. It will lighten. So this is the basic understanding of melasma and hyperpigmentation. Then after melasma, the most, I don't tell it is difficult, but it will take some time to treat the acanthosis nigricans. So what are the reasons for this hyperpigmentation? Main reasons. Yeah, PCOD, sun exposure, then genetics, hormonal imbalance, diabetes, thyroid people will also have this. You can analyze that patients. Then, yeah, insulin resistance. Those who are taking continuous oral contraceptive pills, those people also have this hyperpigmentation. Then, due to some kind of medications also, this hyperpigmentation will happen. How many of you have treated it successfully? Like completely cured? Anyone got the result of completely cured or lightening? Lighten, yeah. Once it's lightened, you can manage it with the internal medications. It will come to the skin tone. Because like if we are seeing the people with like from a distance, we can't see their marks. Once it's lightened, we can manage it with internal medications and our external labors. So it will come to the skin tone. That is the successful area where we can manage the hyperpigmentation or melasma. The treatment will be very long term, but that's fine. People will stick on to your treatment because once they feel that the marks are lightening, they will stick on to you. They will continue the treatment with you. But before that, we have to make sure that these will fade. Trust is needed. First thing. So that's it, the basic idea. If you have any questions, you can ask. More detail will be in the upcoming class about the different kinds of one. We can, like, I am making different kinds of labels for this melasma or hyperpigmentation. Like, if you are very fond of practicing cosmetology, we can do miracles. When to use dry or churna labas and when to use oily labas like Shadadauda Krida. Yeah, labas, you can see, my approach is like this. See, basically you have to understand is during the time of the main class, I will explain my experience only, not from whether what I treated for the past these years, how I attained the result, that I am discussing in the classes. So what my approach is, first I will give them the internal medications and a small churna leba only. I will tell them to continue for 2 weeks and tell them to come back. And by touch wood, we can see visible difference within 2 weeks if they are regularly following the diet and regularly taking the medicines. After 2 weeks only, I will post for treatments like facials. First, I will start with cleanup because I need to know how their face is responding. Then I will start the facials. If it's more deeper, then I will fix for chemical peels or dermabrasion or micro needling in between the sittings. Yes, stress is very much related to melasma. While during the treatment, see, basically, if you are a cosmetologist, you have to do a partial kind of counseling to these people. Have you seen any people, like, if they have some kind of problem, plus if they have any marks on their face, what will happen is, if some kind of if they are going through some kind of mental stress or some problems, then the marks will highlight on their face. That by practice you can achieve that. If a patient approaches you with a dull face, with a enhanced spots, you can ask them, are you something worrying you? Sure, she will tell us, yes ma'am, something is worrying. So stress is very much related. So, sometimes you have to give some mind calming drugs also along with this. Nutraceuticals have wide result while treating the cosmetology, and single drug tablets also we can give. Anything? What can we do for necklines? You mean these lines? The forehead lines? For necklines, basically, you all know the aesthetic treatment will be Botox. But how we can manage it is our facials with Nyavara Potlis, with the different kinds of labor. What we have to do is we have to tighten their skin. So as days progress, their necklines, a kind of reducing, that's it. There is an example in front of you. I have 3 or 4 lines here. Right now it's not there. Because it's basically you have to tighten your skin. Face yoga also have so many effect on this hyperpigmentation. How you are managing your skin. With our facials, we can manage this forehead lines and also the necklines also. It will tighten. Basically, you have to tighten the skin. Once in neck, yeah, basic, same thing. We are doing for neck and forehead lines. PAH is curable. Yes, it's curable. Can we use Ayurvedic products after dermabrasion? Yeah, I am using Ayurvedic products, but by examining the skin very well, on the first day, I will tell them to rest the skin. Next day onwards, see, basically our approach should be more easy because once they in for the treatments, we can give our own products. I am using my own preparations for all the patients, like moisture, whether it is moisturizer, whether it is sunscreen, whether it is serum. I will give it as a combination. So I will tell them to use that only by analyzing the skin. Perimenopausal pigmentation also we can consider in this Venga and we can treat accordingly. It's all the same. The melasma will trigger at what time? Before menopause. You can see in the 45 age women, like while they are approaching the menopause, all their marks will come up. It depends on the management, depends on the depth of the pigmentation, whether it is epidermal, dermal, that you have to analyze first. With the different types of face pack, the Rakta Prasadana or Varnyakara drugs, we can easily manage or we can lighten it. What about lip pigmentation? Lip pigmentation also we can manage. First, you have to take a history of what all treatments they did or what all products they are using. By using some kind of lip oils, lip serums or lip scrubs, we can manage. I am managing it with my lip balms. I am making it with beetroot and blend of some oils. I will recommend them to use at night, apply at night, and lips will come back to normal, the chubby pink lips. Why I am telling the nutraceuticals is very much important in cosmetology, because people will bored of this internal medicines for a long time. So what we can do is, we are Ayurveda people, we have lot of home remedies, right? Like homemade things. So basically what I will do is, I will tell them to do some kind of waters, vitamin C water, some kind of preparations. So they are very good. they will like us because we are not pressuring them to do the internal medications for a long time. We can easily manage this. How much time labor? Once in a day. Basically, I will tell them if the depth is much, for the first 2 weeks, I will tell them to apply 2 times on the part only. That is the basic understanding you need while treating the melasma. First, for the first 2 weeks, I will tell them to put the labor on the area only, not on the complete face. Then after 2 weeks, I will analyze it. Then I will tell them to how to do it. The duration maximum 10 minutes, not more than that. The labor application is important. The labor duration is important. One of the important thing is what base you are suggesting. Base is also important. Any other doubts? Let me ask you one question. What is the most thing we needed for treating the melasma in the case of vitamin C? Which one is essential? Is that vitamin C, B, A? Which one? Which is the most important one? We need all this, but only one answer. It's vitamin C, antioxidant. And how high frequent should we do microneedling? It depends on the condition. Depends on the condition, we will tell the patient. And I will suggest them to come back after 20 days, 20. My duration will be 22 days. There should be a healing period. Sometimes I will take a gap of 1 month, sometimes. But in most of the cases, my approach will be to treat with Ayurveda only. In the worst case scenario, I will go for microneedling. Otherwise, I will treat it with this facials and all. PRP in melasma or I didn't get you, doctor. Like, till these years, I didn't do PRP for melasma. Always I will treat with my different combinations of facials, sometimes with microneedling and peels. Chemical peels have more action for this hyperpigmentation. Basically, I am using lesser concentrated peels, but that has action too if we combine it with our facials. I won't use peels alone. I will combine it together. How the vitamin C, how would you suggest vitamin C to a patient? Is that in the tablet form or how you will suggest to take vitamin C? It's very easy. Which is the rich source of vitamin C in Ayurveda? Tell me the name. It's amla. So what we can tell them is, tell them to infuse 3 or 4 amla, de-seeded, and put in the drinking water. Kept it for 1 hour. All the amla juice will be there. After 1 hour, you can see the water will become a pale white color. Tell them to drink it throughout the day and chew the amla after finishing the water. That is the best way for vitamin C to absorb. And this is a best remedy for both skin and hair. And also what will happen is, once they started drinking this amla, their digestion will also improve. I think in all the classes, whether I am taking the hair or skin, I will tell the doctors, first you have to see, before practicing like cosmetology, what I did is, I tried every treatment on my face first. Then only you can tell confidently to your patient, these will create magic to your skin. Whatever labas you are making, first try it on your face. Then you can easily suggest to your patient. If a person have allergy towards citrus fruits, then you can suggest them to use other sources of vitamin C. We have other sources. Tell them to use the, what it is called, spinach, like that. So if you are not using vitamin C like this, start doing it today. So you can feel the difference in your skin. If you have an acne prone, then it will subside within 1 week. That is the magic which amla can do to your skin. Even you can tell the kids also can drink the amla. And amla infused water. Why we should go for the vitamin C tablet, doctor? Yes, you can. But this is better. You can also tell them to take vitamin C tablet. Effervescent tablets are available right now. You can take that. Vitamin C content, effervescent tablets are there. But better go for the pure way, because that will give faster results. These I tried and I got so much results. Amla, just take 2 or 3 amla. If it is big, take 3, take 2 only. If it is too small, take 3 or 4. take the seed out of that amla, slice it into small pieces and put it in the bottle which you are drinking the water. Pour water in it and kept it for 1 hour. After 1 hour, you can see the water become pale white and you can drink it. And after drinking the water, at the end of the day, chew the amla. Or another thing you can do, it is the water soaked amla. You can make an hair pack out of that. That also you can tell the patients. So both skin and hair will get the result. These kind of small homemade recipes are there, so that people are very much interested in doing that. So that way we can align them to us. Any other doubts? Why I am not showing the PPT is because this is a vast topic. It won't end in 1 hour or 20 minutes. It's very vast because so many research is happening for this hyperpigmentation, both in Ayurveda and modern. So it's very vast, like the types, how the skin scale, like skin, the Fitzpatrick scale type. So many research is happening also. Which medicine should choose for Virejana? Basically, I am giving Avibhati Churna, Manibhadra Guda also. I will give the patients. Both will work better. Yeah, Nitya Virejana, you can go for the Nitya Virejana. Small doses will act. If it is Avibhati Churna, you can tell them to have 1 teaspoon with lukewarm water at night. If it is Manibhadra Guda, just tell them to take. Manibhadra Guda, sometimes I will tell them to stop after 2 weeks. But Avibhati Churna, I will give as Nitya Virejana because it is in the mild dose. Any other doubts? How many of you are doing facials in your clinic as part of, not like a beauty parlor, but to treat for skin wellness? Yeah, dark circle of eye we can treat very easily. Have you heard of Bidalaga? What is Bidalaga? Okay, doing facial. What is Bidalaga? Yeah, with the external, I have done in previous job, not using current. You have to start with a less budget. You can start. The dark circles we can treat very easily with the eye massages, eye packs, and also have you heard about the eye wash, Netra Nedi? That also subside the dark circles. Tell them to do it continuously so that but before treating the dark circles, one thing I have to tell you, you have to differentiate it whether it is a dark circle like a pigmentation or it's a shadow. Both will be there. Shadow we can easily treat. Dark circles, like it will take some time. Yeah. Vidalaga is applying paste over eyelids, avoiding eyelashes. That is the basic treatment we are giving for this. How to differentiate? Basically, the shadow will be in a lighter version. Dark circles, you can, here it will be more darker. Shadow will be much lighter. And also sometimes Tarpana will also, I am getting results while doing Tarpana for the dark circles. Upper eye, both upper and lower will subside with the same treatment. And Nasya is one of the main treatment which I am giving for the this pigmentation cases, whether it is dark circle or Nasya is very important in these cases. Any other questions? I am not considering it a specific oil for Venga. Basically, I will use Kungumadi Taila for Nasya, 2 drops. I will tell them to instill daily 2 drops. But I will suggest it after doing the facial treatments or the internal medications. At a point of stage, I will tell them to do Kungumadi Taila Nasya. Then sometimes with the treatment side Nasya also I will tell them. Yeah, it's expensive, but you can make it and you can give it to your patient. I am giving my own Kungumadi Taila to my patients. Anutaila Nasya also will give you result. I didn't use neem oil yet. If any of the doctors have experience in that, they can share it. Because our aim is like, why I give this, we need some kind of Rekta Prasadana Varnyagara to reduce the lighten the marks. And the Nalpamaradi Kera will also work for this melasma. daily massage with Nalpamaradi will also work. Eladikera. For some people, Eladikera will also act, but I got more result with the Nalpamaradi. Charges for procedures, it depends on what investment you have, doctor. Like, if you invest less, then you can start with less charges. If you invest more, you can charge more. See, if you are practicing a cosmetology, everything should change. Our outlook should change. Our overall attire should change. First thing, they are looking into your face. So first, your face has to change. Okay, your hair, your face, because daily I am facing so many patients. Like, they will keep on asking me, doctor, you have some spot on your face. See, people will look into your face and hair first. So you have to change your outlook first. Then only people will approach you with a trust. Facials, how many days gap we can do? Monthly once. If you are doing a facial on for example, on September 1st, you can tell them to come on September 30th. Basically, here in my clinic and hospital, I will do monthly once only. If you are like, once you are making a structure for the cosmetic treatments, don't go beyond 1,000, because you know all the road drugs right now we are getting in a heavy price. Why we are charging very less? We are also doing the cosmetic treatment, right? If you are going for an aesthetic clinic, how much do they charge? Like that, the overall approach of the clinic, the overall feel whether they are getting, we can give that. So don't charge below 1,000. The cleanup, you can charge for 800, like that. Here in my clinic, the base facial starts at 2,000. What is the treatment for overall fading of the face? Yeah, all our Ayurvedic facials will help in tanning. Can see visible difference immediately after the facial. That's the magic of Ayurveda, how you are formulating the face packs, how you are formulating the facials. We can incorporate like galvanic, we can incorporate high frequency, we can incorporate. We can make different types of facials with, we can do acne prone facial, we can do pigmentation facial, everything. Yes, I will explain the detail. That's what I am trying to convey on the main class. How you can treat hyperpigmentation in a cosmetic clinic by managing with the facials and internal medicines and all. Any other doubts? See, once we start the main class, each day you will face, or in your brain, different kind of doubts will appear. That's how the cosmetology will progress. Before starting the cosmetology, we should be very curious. We need to learn every day. We need to try out different things. Then only we will grow. Yes, that is the first thing before we post for a facial. We need to consider the skin type. With the bare eyes, you have to recognize what skin type they have. That by practice, you can learn that with bare eyes, without any dermatoscope, without any wood lamp, you can analyze the skin type while patient entering the clinic. Skin type is very important. Before then only we can choose the right face pack, right scrub, because all the scrubs will be different. For tanning, we can make one scrub. For acne prone, we can make one type of scrub. Face packs, oils will be different. So skin type is a must. We have to recognize the skin type first before doing any facials. I hope all the questions are over. Dr. Adira?
Yes, ma'am. Yes. Thank you so much for the wonderful session. Thank you so much.
I think what should be the consulting charges? I am charging 200 only for consultation. Okay, thank you so much, doctor.
Thank you so much, ma'am. And thank you so much, Dr. Anjana Madhu, ma'am, and Miss Binu Bhatia, ma'am, for this wonderful and enlightening session. Yes, recordings available. Actually, your knowledge and clarity and practical pearls have truly added immense value. And my heartfelt thanks to all the doctors and here with us today. Your enthusiasm is what makes these sessions meaningful. So now, before we close, I am excited to announce our next program, VARNA JEEVAN Intensive Certificate Program on Hyperpigmentation. So the dates are September 27 and 28. Mode is Zoom. Live plus recordings available for 2 years. Certificate provided and exclusively for doctors. And this program will cover hyperpigmentation types like melasma, PIH, dark neck freckles, etc. And time is 7:30 p.m. And recordings also available. So all details will be shared in the WhatsApp group. If you are not yet in the group, you can contact in the given number. You can take the screenshot. So in a very short time, Amogatri has trained over 1,000 plus professionals across multiple certificate diploma programs, and the reviews are consistent. So this is the standard we promise for Varna Jeevan as well. With that, let me once again thank our wonderful faculties and all of you here. Together, let us continue this journey of making healthcare more holistic, evidence-based, and impactful. Thank you so much, all. So we can wind up. Thank you.